Again, my name is Amanda Gunter, and I just want to welcome you guys to this webinar called The Brain and Sensory Processing. I have to say, this is actually one of my most favorite presentations, more or less because of my personal journey on how I came to brain balance personally. So my background is in special education, and I actually taught children that struggled with sensory processing. At the middle school level, we had a variety of diagnoses in my classroom, from high functioning autism to behavioral disorders, just a wide array, but all of them really struggled with sensory processing. And of course, I was an ABA teacher. I had an ABA classroom, and we would extinguish some behaviors and then other behaviors would come back. And I always just felt like I was weed whacking, if you know what I mean. I was always just trying to accommodate and modify for our kids. And I actually personally had a student go through brain balance almost 17 years ago at this point, and it was life-changing for that student. And so it really opened my eyes as an educator to think about brain function and brain development, and that our children's brains are still growing and developing, and what can we do to improve brain function, and how that can help eliminate some of the struggles that our children struggle with. So sure enough, brain balance was very new back in the early 2000s. And I decided that this is something I had to be a part of. And so I left teaching back in 2006, and I haven't looked back, because it's just so rewarding to see where our kids can go, and that the future is bright, and that there is hope. So today I'm going to share with you guys just some pieces of information of understanding perhaps why your child may be struggling. So first, I want to ask, one of the things we're going to do on this presentation is we want you to be engaged with us. And so we're going to be asking you polls. And so we have our first poll question, and that is this your first time joining us in the webinar? And just click yes or no. And throughout this presentation today, we are going to be asking you questions so you can engage with me, you can answer the questions, and it helps me to be able to present even better and speak to your needs and your personal challenges as a family. And that is our goal when it comes to webinars, is we want you to, of course, gain more information, learn and have a better understanding perhaps of why your child is struggling, and then also provide you strategies and tools that you can use immediately to activate your child's brain to improve brain function, to help eliminate some of the symptoms that you're seeing. So sure enough, 77% of you are new to our webinar. And so we just want to welcome you, and we're excited you're here. And we absolutely, my hope is that you leave today with a better understanding perhaps why your child is struggling. We have several brain balance centers that are on live with us today, all over the country. We have 3 centers in California that are participating: the Brain Balance of Redlands, San Diego, and Chula Vista. We have the Brain Balance of Delaware, Wilmington, Delaware, participating. We have several centers in Florida, from Central Florida, which is Winter Garden, Lake Mary, Coral Springs, Jacksonville, Naples, Palm Beach, and West Chase. We have 3 centers from Georgia participating today, which is Peachtree City, Roswell, and Swanee. We have the Brain Balance of Plainfield, Indiana. We have 2 in Kansas, which is the Brain Balance of Overland Park, the Brain Balance of Wichita. We also have the Brain Balance of Oakland County, the Brain Balance of Woodbury in Minnesota, the Brain Balance of Omaha in Nebraska. We have the Brain Balance of New Jersey from New Jersey. We also have the Brain Balance of Plainview, which is out of New York. We have the Brain Balance of Greater Charlotte, Brain Balance of Columbus out of Ohio. We have the Brain Balance of Mount Pleasant from South Carolina. We have the Brain Balance of Farragut and Franklin out of Tennessee, the Brain Balance of Allen and Lubbock out of Texas, and the Brain Balance of Midlothian. They are going to put up in the chat a way that you can communicate with them immediately. Many of them have texts where you can be texting with them, but these directors are on live today to answer any questions specifically about your child. And so pick out a center that's nearest you and feel free to communicate with them even while we are in the webinar. So first I want to talk about what is sensory processing. Sensory processing is the effective registration and accurate interpretation of sensory input in the environment, including one's body. It is the way the brain receives, organizes, and responds to sensory input in order to behave in a meaningful and consistent manner. Now, that is a mouthful, I'm sure, for all of us. But basically what it says is that our brain takes in all of the senses that are around us, from what we hear, what we see, even what we smell, what we feel, or perhaps don't feel. But basically, our brain is interpreting the world around us, and actually from senses and sensory input, that actually helps develop a child's brain. And we're going to talk about that more related to how senses impact brain development, but also how senses impact the way the brain interprets information. So one of the questions I have for you is, does your child have a formal diagnosis of either a sensory processing disorder, a generalized anxiety disorder, autism, or perhaps it's another diagnosis, or that maybe you have no formal diagnosis, but you're actually seeing and experiencing some of the symptoms of a sensory processing disorder. Many of the families that come to Brain Balance actually are like, I don't even know if I want to have my child diagnosed. So we do tend to serve families that may not have a formal diagnosis, but yet they are experiencing symptoms of perhaps a sensory processing disorder. So let's see, what are you guys struggling with today? And wow, okay, so 41% has no formal diagnosis. And we often see this in Brain Balance, is that families are wanting to equip their children with as much as they possibly can to avoid a diagnosis. And that's okay, that's your preference. And there are pros, to having a formal diagnosis. But also too, there's a lot of families that say, hey, I want to try to resolve this before we even get to having to have a formal diagnosis. And that's all right. We definitely can serve both families. All right, so let's see here. So let's talk about sensory processing, and there are elements of sensory processing related to hypersensitivity of senses, where basically your child can be oversensitive to stimuli around them, meaning that you go in public and noises can be a problem, or even just going outside, the sunlight can be a problem. Or when maybe they're in a classroom and there's a ton, as you know, teachers love to decorate their classrooms, and there's a ton of visual stimuli in the classroom, and yet they're struggling perhaps with paying attention because of all of the visual clutter that's going on in their learning environment. Hypersensitivity, some of the symptoms of hypersensitivity could mean that they prefer certain types of clothes, or you have to cut out tags of certain shirts or pants, or perhaps they're sensitive to hugging or touching or being touched, or perhaps they gag or vomit when it comes to certain smells or the looks of certain foods. Or when there's loud noises, they easily startle, such as a classroom bell or a fire alarm or basically emergency trucks that are coming through the neighborhood. They can struggle with all these different types of stimuli. So these are signs and symptoms of what we call hypersensitivity to sensory input. And basically, what ends up happening is they can easily start crying, they can hum loudly or rock back and forth, or all of a sudden their face gets flushed and turns red, their hands can get clammy, or they really can just become extremely anxious and they want to run out of the place or out of the location that you're at. And then we also have hypo-sensitivity, which means that they're undersensitive to certain things. Perhaps you're dealing with bedwetting, where a child doesn't fully feel their body and they don't know when they need to actually go to the bathroom. Or perhaps when they go to hug friends or hug you, they hug really hard. And that's something that is challenging. Or perhaps they're rough with pets at home and yet they don't realize how hard they are being. They often can, and what we see basically in teenagers is that they can be prone to high risk behaviors because they don't physically feel their body appropriately. They can have difficulties with keeping their hands to themselves. They also can easily drop things or break things because they're not able to measure appropriately where they are in space because they don't physically feel their body appropriately. So that's oftentimes where you can see where they're space invaders, or they need to cuddle, or they want to touch all the time, or they have uncontrollable movement where they're flapping their arms or they're wanting to bounce or spin constantly. You often can see where they're chewing on clothing or pencils. Again, they may not be aware of the danger because they can be risk takers. And then also too, that when you see a child that's sensory seeking as they become older, it's really interesting to see how the behavior changes, where they actually cross boundaries and they actually need to feel that rush because they don't experience pleasure appropriately. You can also see as they get older, self-harm type symptoms that can occur due to undersensitivity, or what we call hyposensitivity. So there's many symptoms that occur related to either hypersensitivity or hyposensitivity. And so our next poll question here really is asking, what do you feel like your child or your young adult is struggling with? Are they struggling more with hypersensitivity, or are they struggling more with hyposensitivity? Or are you thinking to yourself, wow, I feel like my child or young adult is struggling with both? Because the reality is that your child will actually mature into a teenager, and oftentimes these symptoms, they don't let's just say they don't go away, the symptoms just may change. Same thing with a young adult. The symptoms don't go away, but they may look a little bit different. So what do you feel like your child or young adult is struggling with? More of hypersensitivity or hyposensitivity? Or are you like, gosh, I really see both? Let's see what you guys have to say. All right, signs of both, and then hypersensitivity. And that is definitely something that we hear often within the centers. And the reality is that it impacts home life, right? Because it impacts your siblings or other children, because many times we hear in the centers, gosh, when we're wanting to go out in public, we have to really think through, what is this going to look like for our child that struggles with sensory processing? You may have to bring headphones. You may have to have a plan B, where if it doesn't work out, one parent is actually having to leave. Many times I've heard over the years where one of the parent just stays home and they actually don't go as an entire family anywhere because of the difficulties related to sensory processing. Of course, it can impact marriages where there's extreme stress of what can you do and how can you help your child that's struggling. Oftentimes we hear parents are struggling with what does the future look like? They're dealing with constant meltdowns, which everybody's walking on eggshells, and that just there's a heightened state of anxiety in the entire family because of the difficulties related to how outings are going to go or how situations are going to happen outside of home. Then, of course, it impacts school because, again, if a child is struggling with sensory processing, the classroom environment is extremely stressful. And we're going to talk about actually what is going on in the nervous system of a child that's struggling with sensory processing. Because when you really have a better understanding of the neurological perspective, that is something that is really helpful, not only for you as parents, but helpful for family members and even helpful for teachers that are also having to work with your children. Of course, they can struggle with following directions, difficulties with processing information, because again, they're extremely overwhelmed. The lunchroom is extremely stressful for a child that struggles with sensory processing. When I taught, we actually had a lunch bunch group that actually stayed back and didn't go to the big lunchroom. We actually had some of the other students come and join us in our classroom. So again, they could get that social interaction piece, but yet they didn't have to hear all of the noise from all several hundred kids that are in one room, right? Because that's what's really struggling when it comes to sensory processing is all of the noise, the visual input, and that's something that can be really impactful when it comes to school environment. It also impacts social life, right? Because your child can be struggling with making friends, where the kids can understand why your child is struggling so much and really being able to have those meaningful relationships. Of course, when it comes to teenagers, you see where they become more and more withdrawn, where they're not wanting to come out of their bedroom. They're not wanting to leave the house. I was working with a family recently in one of our brain balances where their daughter was 8 years old and she had gotten to a place where she did not want to leave her house because everything from outside to any stores, any restaurants were so overwhelming for her with all of the sensory input and the anxiety that came from that she really was refusing to leave the house. And what we find is as the child becomes older, those are the coping mechanisms that they tend to utilize to where they start skipping school, right? They really become more withdrawn and they don't want to interact with other people. And then, of course, when it comes to young adults, they're not interested in driving. They don't want to learn how to drive or get their driver's license. And then you have the failure to launch situation. Or when they're in a work environment, they're really struggling with the team dynamics because it could be as simple as someone chewing their food. And yet, if they're hypersensitive to sound, that's something that can be really impactful. So one of the things that, when we're thinking about not only right now, what does it look like in your child, but then also too, what is it going to look like in the future, and what changes have you seen over time? Because this is something that many families deal with, that the symptoms change. And we have another poll question that's going to come up, but that the symptoms change as your child becomes older, and it looks different as they become older and they mature more. So one of the questions we have for you is, where do you feel like this is struggling? More in the home environment, in school environment, in social life? Where is this actually being more prevalent for you in the different environments? And I'm not seeing the poll question pop up. I don't know if they're struggling with getting the poll question up, but that's what the poll question is, if we can get it up. If not, then we'll just have to move on.
It's up, Amanda. We've had 114 people answer already, so we'll
great.
give them a few more seconds.
Okay, awesome. Thank you. It's not up on my screen, so, but all right. So So this is where, again, we're really wanting to see, where does this impact you as a family? You know, because it can impact you in multiple environments. And then also too, if your child is between the ages of 3 and 7, a lot of times there's a lot of emotional meltdowns during those ages when they're younger. And you may not even realize that their meltdown is related to sensory processing, you know, because of course, if they're not able to communicate as effectively, and of course, when they're young, they're not able to fully communicate what they're feeling and what they're thinking, right? And so those are things that really are something that can be a struggle, and yet you don't even realize it, but yet they're having a ton of meltdowns in multiple environments. And then of course, as they get into school, it can look even different. And that's when you can start getting the feedback from teachers and educators of what they're seeing and what they're experiencing. Now, Nicole, I'm not seeing the poll pop up, so you're going to have to help me out a little bit if there is a response, because I'm not seeing it on my end.
Yes. So we asked the question, where are you seeing your child or young adult struggle in life the most out of those 3 areas that you just spoke about? And the overwhelming response was in all areas: home, school, and social life. And then we also asked the question, how significant do you feel like the impact of those struggles is on the day-to-day life? And the most common response was a 4, which is pretty significant.
Yeah. Wow. So that is definitely something that we hear often in our centers. And yet, what I've just described to you guys and what you've responded to me about are symptoms. All right. Symptoms that's impacting your home life, symptoms that is impacting your social life, symptoms that are impacting school life. But at the end of the day, what I just talked about is really just symptoms. So what's really going on? Well, here's what the research is saying. The research is saying that difficulty with behavior, focus, memory retention, academics, life skills, social skills, often comes down to a lack of brain connectivity. So really what I want to talk to you about today is what's really going on in the brain of a child that's struggling with sensory processing or behavior or difficulties with social and emotional development. And it's all related to how is your child's brain processing their senses. And so the goal is to have optimal processing in the brain, okay, is basically a brain that's teachable. So the better processing that's taking place in your child's brain, all right, will allow your child to be able to learn and grow and socially and emotionally develop. All right. And so that's what Brain Balance is all about, is we want to be able to develop a brain that's a teachable brain, develop a brain that can handle all of that sensory processing. So what I just talked about for the last several slides were symptoms. And what I love about this picture of an iceberg is that everything that we just described is basically the tip of the iceberg. Okay. It's the visual symptoms that you're experiencing and your child is experiencing every day. But yet there's a lot related to what you can't see. And that's related to how is your child's brain processing all of that sensory input. So one of the first things I want to talk about is all the way at the bottom. So one perspective that we utilize at Brain Balance is we look at things from what I call a developmental perspective, is how your child's brain should develop neurotypically. All right. And it all starts with the development of primitive reflexes. Now, primitive reflexes are involuntary motor responses that every baby is born with. Okay, they facilitate in the birthing process, and I like to call them survival reflexes. And the reason why I like to call them survival reflexes is because as a baby, your child's brain isn't fully developed yet. Okay, and then what develops the brain? Well, what develops your child's brain is sensory input So what they see, what they hear, what they smell, and what they feel. So senses actually develop the brain, and motor develops the brain. But in a baby, okay, when they're first born, they have these survival reflexes that are involuntary motor responses that are there to keep the baby alive, because the baby isn't able to sit up yet, isn't able to lift their head or roll over, right? It's just a baby. It requires for you as the parent to take care of them, but also too, these reflexes are active because their brain isn't fully developed. So for example, there's a reflex called the Moreau reflex or the startle reflex. And this reflex is present in babies because, again, when they hear a loud noise, they're all of a sudden their startle reflex or their Moreau reflex startles, okay? And that is an alarm for the baby to think maybe I'm in danger. So their breathing becomes rapid, their heart rate becomes higher, their little face becomes flushed, they can start crying because, again, it sends an alarm. And so, of course, the baby starts crying, and then you as the parent come into the picture to soothe the baby, to see what's wrong with the baby, to see what the baby needs. All right, so these are survival reflexes. But the reality is that these primitive reflexes shift your child's nervous system from what we call parasympathetic into more of a sympathetic response, where they respond out of emotions versus responding out of reasoning. So in a neurotypical situation in a baby, these primitive reflexes are active throughout the first 18 months of life. And they start maturing because as your baby's brain develops, they no longer need these survival reflexes or what we call primitive reflexes. Okay, it's like as the brain is growing and developing, they don't need these reflexes any longer. Now think about this. Senses develop the brain. So what your baby sees, what they hear, what they smell, what they feel, all of that develops the brain. So if there's underconnectivity taking place in brain function and brain development, that can impact, if they're not processing their senses appropriately, that can impact the way your child's brain is developing, even in a baby. Okay, so that is something that can impact brain development. Also, think about motor develops the brain. So that's why the motor milestones are so important. A baby lifts their head, rolls over, sits up, crawls for 4 months, stands up, walks. Motor develops the brain. And then even after they're walking, think about it. When you have a child that's coloring at the age of 2, okay, they could be coloring on the walls. Their palette is very broad. They don't color in the lines, right? But then as they are growing and developing, age 3, they have a better grasp. They start coloring on big, pads. At age 4, they're coloring in the lines. Age 5, they really are writing their name. Of course, it's big, it's crooked. But then, of course, age 6, their handwriting should improve. Age 8, their handwriting should improve again. So as you can see, motor, gross motor functions and fine motor functions, again, the more sophisticated the motor movements are, the more coordinated their body is, the more coordinated their brain is. So just like you heard in that testimony, when that mom was talking about, my child couldn't ride a bike or was really struggling in kicking a ball and catching a ball. When you see symptoms like that, those are other symptoms, maybe not sensory processing symptoms, but those are other symptoms related to underdevelopments in the brain. All right. So here we have primitive reflexes that are survival reflexes that should mature as the brain matures. They should not need these primitive reflexes anymore. However, when there's underconnections in the brain, these primitive reflexes can still be active. All right. And so when there are still primitive reflexes that are active, you have what we call parasympathetic, and then you have sympathetic response. And here's the thing, every person If you're an adult or you're a child, you have both nervous systems. You have what we call parasympathetic, which is rest and digest. Your nervous system is calm. You're using what we call the upstairs part of your brain, which is reasoning and comprehension. And your heart rate's normal, your breathing's normal, your body temperature is normal. And the reality is you want to function primarily out of parasympathetic. However, sympathetic is there, and it's an important role because if you are in a dangerous situation, you want your sympathetic nervous system to kick in. You want to respond out of emotions versus out of reasoning. Okay, because reasoning takes time, processing takes time. If you're in sympathetic, you're responding out of emotion. So you're either what we call fight, flight, or freeze. You're either running, you're either fighting, or you're freezing. But basically, your nervous system is saying danger, danger, danger. But here's what happens is that if a child has a retained Moreau reflex, and remember, primitive reflexes retain and can retain because there's underdevelopments in the brain. So again, if your child is struggling with sensory processing and they're struggling with being able to process senses appropriately, that impacts the way the brain develops. And then all of a sudden they can have these retained primitive reflexes that's also inhibiting development. And so now your child may be 5, 10, 15, 20 years old, 30 years old. And if you still have an active Moreau reflex, certain sounds, certain smells, certain textures, certain visual stimuli can activate this nervous response. And then all of a sudden, it's like a flip of a switch where your child could be calm and they're processing things appropriately. And then all of a sudden something happens, an alarm goes off, maybe it's the fire alarm, maybe it's emergency vehicles coming down the street. And then all of a sudden your child's nervous system shifts into that sympathetic response and they respond out of fight, flight, or freeze. And then that's when you can have the anxiety, the inflexibility, the emotional dysregulation. They can actually have senses heightened because when their nervous system is heightened and they think that, they may not think that there's danger, but their body is responding because the nervous system is responding to danger, then all of a sudden certain sensory systems can even be heightened more than normal. And then this is where it impacts social and emotional development, being able to, handle change, being able to learn, and just really overall functioning. And then in adulthood, this is where you have the failure to launch because they're stifled. They are really stuck. And yet they don't know what to do because their nervous system is responding out of fight, flight, or freeze involuntarily. And I want you just to sit with that for a second, because so many times, we can hear teachers say, well, if they would just focus, or if they would just, focus on what's important and, be able to ignore what's not important, or if they could just handle the change, or perhaps you as a parent are frustrated and are just like, I don't understand why they can't just wear the clothes that I lay out for them. What you have to realize is a lot of times sensory processing is an involuntary response, meaning your child is not cognitively choosing to have these meltdowns. They're not cognitively choosing to respond negatively to auditory stimuli or visual stimuli, but yet their nervous system can become dysregulated. And so it's an involuntary response that they don't have control over. And I think that's something too that, is really hard. And that's why we see a rise of anxiety as your child becomes older, because they just feel trapped. They feel like they cannot control this, and yet everyone around them says they can control it, and that they just need to try these coping skills to get through. And yet their heart rate is higher, their body temperature is higher. If you actually feel their hands, they have clammy hands. If you look at their eyes are dilated many times. And yet these are all involuntary responses. And I think that's important to think about. And then this is where you get the sensory overload, where everything becomes a challenge, where noises become a problem, from clocks ticking to coughing to chewing food to the class bell, where flashing of lights and loud music and crowds become a problem, where scratchy costumes and unfamiliar surroundings become a problem because their nervous system is responding as if there's danger all around them. And that's when oftentimes parents say, I feel powerless. I feel like I don't know what I can do to help with my child that's struggling with things that are going on around them. And then if we think about this, just moves into adulthood, because there's this inability to complete tasks, or there's this difficulty in being able to be successful with higher education or even a job. We a few years ago worked with an adult where she was brilliant. She was at Duke University at 16 years old. She had 2 degrees, that she was very intellectually very strong. But yet her boss came to her and said, if you don't get some help, we're going to have to let you go. Because she would get into a staff meeting and little things would set her off, from somebody chewing, or what she called smacking, to a change in the schedule or a change in what the process was that she was supposed to be working on, or the assignment they had given her. And she would just have a full-fledged meltdown and would storm out of the meetings, would slam the doors, and basically go to her office. And then she would be stuck where she couldn't perform or do any of her work for the rest of the day. And so that's where, again, it can limit career choices. It can impact personal relationships. And so that's something that it doesn't just go away in adulthood. It's just that it can look a little bit different. So one of the things that, again, we have another poll question, that basically it's one of those things where, one of the questions I have for you is, anyone explained the role of primitive reflexes and how it impacts development of the brain and sensory processing? And do you feel like your child is functioning more out of their sympathetic nervous system based on the symptoms that we just described, which are really the quick emotional dysregulation, or the sensory sensitivities like tactile or auditory sensitivities, or just high anxiety? Because one of the things that I want as a takeaway for you today is to understand that sensory processing and the challenges of sensory processing is absolutely an involuntary neurological response. And oftentimes, children and young adults and adults can still have active primitive reflexes that shift their body from parasympathetic into more of a sympathetic response. And so this is something that I think is super helpful for you as a parent to understand. And as you even say, no, nobody's explained this to me. 66% is saying, no, I haven't been explained this. But yet, hopefully this is helpful, because this is something that can be super helpful when we're going to talk about, okay, how do you shift them out of sympathetic and more in parasympathetic? And we're going to talk about that today, because I want you to have strategies immediately that you can try with your child to help regulate their nervous system, because that is definitely something that is super helpful for any parent, right? When you can look at things from when you can look at behavior from a neurological perspective versus just that traditional behavior perspective, where they just need to use coping skills to get through. Well, actually, no, we can do things that can actually help stimulate their brain to shift them out of that sympathetic place. And we're going to talk about that in a few minutes. So this is one perspective that we look at Brain Balance, is more of what we call a developmental perspective. The other perspective that we're basically the only program that looks at it this way is what we look at is what I call from a hemispheric perspective, because the reality is that a balanced brain is a teachable brain. And so we have two hemispheres of our brain. We have the left hemisphere of the brain and we have the right hemisphere of the brain. And both hemispheres of the brain need to be developing appropriately, because each hemisphere has responsibilities and different sides of functions. All right. And they often complement each other, left brain versus right brain, but they need to be equally developing. They need to be constantly communicating, and they need to have what we call strong neural pathways between them to be able to fully connect. So left hemisphere, I often try to say it's more like, if you think about more of like the gas pedal of your brain, it's your processing hemisphere. It's your go, go, go brain, okay? It's about remembering facts and details. It's about verbal communication. The left hemisphere of the brain is responsible for small muscle movements or fine motor. It's about linear and logical thinking. It's about pattern recognition and being able to pick up patterns. And also being able to follow patterns is very left brain. The left hemisphere of the brain is responsible for intellect, or what we call IQ. It's responsible for motivation and setting goals. It's also about processing, auditory processing, visual processing. Just how fast does your child process what they hear? How fast do they process what they see? Academically, it's about numerical operations, word reading, phonics, spelling, grammar is very much left brain. Academically, between pre-K and second grade, there's a lot of left brain academics that are taking place. But the left hemisphere is the gas pedal. It's the go, go, go hemisphere, as I want you to think about. The right hemisphere is the brake pedal of the brain. Just think about the ability to stop and think before acting. It also is about being able to process appropriately sensory input. So I often want to share that and say that the right hemisphere of the brain is almost like a governor system to help regulate sensory input. When things need to be heightened and that left brain needs to be, processing quickly and auditorily processing. But then also when you think about being in a restaurant and there's lots of noise going on, and maybe you're sitting there at a table and you're talking to someone across from you, what you don't realize is that the right hemisphere can actually dampen sensory input. So where you can focus in and listen to the person that you're talking to, and it actually can dampen sensory and auditory stimuli around you. All right, so the right hemisphere of the brain is about modulating sensory input. It's also about reading nonverbal skills and facial expressions. It's about being able to see the big picture, or what we call global coherence. It's also about flexibility, being able to be flexible and being able to handle change. All right. The right hemisphere is also about controlling impulsivity. It's about being able to process what you're feeling, versus the left hemisphere processes more what you're thinking. So left brain is processing more of what you're thinking. Right brain is more or less processing what you're feeling. So the ability to physically feel your body, which again, when we think about children and do they have a high pain tolerance, because that's also connected to eye contact. When your child doesn't physically feel their body well, that can also impact their eye contact. And then also academically, the right hemisphere of the brain is about reading comprehension, math problem solving, written expression, the content of their writing, being able to see the big picture and having what we call global coherence. Those are all more of a right brain function. So again, we have both hemispheres of the brain. They need to complement each other, obviously. So left brain gas pedal, right brain brake pedal. All right. Left brain's more about processing. Right brain is about regulation. All right. So emotional regulation, sensory regulation. But at the end of the day, it's about connection. The right and left hemisphere need to be equally developing. They need to be constantly communicating, and they need to have strong connections. Oftentimes, children that struggle with sensory processing, there's an imbalance taking place where you can even have overdevelopments, specifically in one hemisphere of the brain. And this is oftentimes when you can see giftedness in your child, where they're functioning above their chronological age in certain areas, okay? Where they're above average in certain areas, or they hear noises that you can't even hear. And you're like, how in the world are they able to hear such detailed noises, right? So there can be areas of the brain that are overdeveloped, and there can be areas of the brain that are underdeveloped. And remember how I talked about that primitive reflexes inhibit development. All right. They inhibit development. They inhibit development of a child's sensory systems. They inhibit development of a child's motor systems, gross motor, fine motor. And then that's when you can have this imbalance taking place in the brain, where certain areas of the brain are developing, or they're even above average. And then yet there's other areas of the brain that are underdeveloped. And what ends up happening is when you have an imbalance taking place, one side can mature faster and at a faster rate, and even can become overworked. And yet the weak side can become more inhibited over time because there's an imbalance. I often love to try to explain it because many parents grew up, right? We grew up with the internet. We grew up with the development of the internet. Imagine if you have one hemisphere of the brain functioning on Wi-Fi or Google Fiber, where it's really, really fast. And yet because of underdevelopments in the other hemisphere of the brain, it's functioning on dial-up. And because they're functioning on two different speeds, they're not able to effectively cross-communicate. And that's when we get the signs and the symptoms of underconnectivity. Oftentimes, children that struggle with sensory processing can have underdevelopments in the right hemisphere of the brain, but there can be other symptoms taking place that maybe you haven't thought about. Not necessarily that they have to have all these symptoms, but yet they can have awkward movements or body awareness where they have underdevelopments in their ability to move their body in space appropriately. They can have low muscle tone where they're not interested in sports. They can have poor eye contact. They can be that space invader that we talked about. They can miss facial expressions and facial cues. They can have repetitive behaviors. They can be obsessive with certain things. They can struggle with the ability to stop and think before acting and have lack of emotional control. They can struggle with anxiety because the right hemisphere of the brain, again, modulates emotions and can help control anxiety. They can often be immature socially and emotionally, and struggle with social skills on top of all of the difficulties with processing their senses. So here's what we have, another poll question for you. And I love how everybody's answering these so well. But basically, outside of the sensory processing symptoms, what other symptoms does your child identify with? And you can click multiple It could be clumsy or struggling with coordination in sports. It could be hyperactive and impulsive, or difficulty with nonverbal communication. Perhaps they struggle with emotional control, difficulty with focus. Perhaps it's repetitive and obsessive thoughts or behaviors. Difficulty, missing the big picture, poor eye contact, or maybe you're seeing many of these symptoms and it better fits all of the above. But basically, our point is that when you have underdevelopments in the brain and you have even overdevelopments in the brain, that's when you have this asymmetry taking place. And that's when you can have what they call a disconnect, where there's areas where your child is doing really well in, and then yet there's other areas that they can be struggling in. And that is an accurate picture of an imbalance or underdevelopments in the brain. So let's see what you guys had to say. Interesting. Okay. So overall, it looks like hyperactive and impulsive, difficulty with anxiety and difficulty with lacking emotional control, difficulty with focus and attention. Of course, the poor social skills and space invader. So those seem to be the most common symptoms that your child is struggling with outside of just the sensory piece. But here's the good news, is that what we specialize in specifically at Brain Balance is to address the imbalance, to be able to strengthen brain connectivity, where we don't focus on your child's strengths, but we actually focus more on the weak areas. And how do we do that? How can we develop the brain? Well, here's the good news, is the brain develops through senses and through motor development. So we can focus specifically on this right hemisphere, where we can actually develop specifically areas of the brain that are underconnected. And we use a traditional model. In the essence of that, we want to use a developmental model where we can activate specifically the right hemisphere of the brain through your child's sensory systems, through their motor systems, because just as we shared, we know that there are specific things that can help activate the right brain through their core strength, through their muscle tone, through improving body awareness. There's even certain smells and certain sounds and certain visual components that can activate the weak area of the brain. And so this is where, again, we want you guys to have resources immediately. And so this handout is actually going to be posted in the chat. You will also get it on email, because we do email it out to any participant that we have, where you can activate your child's brain through their sensory systems. So through smell, there are certain smells that help activate the brain. There are certain visual components that activate the brain. There's even tactile stimuli that help activate the brain. So this is where, again, you being able to put together a multi-sensory component with auditory stimulation, visual stimulation, tactile stimulation, and even smells that can help activate specifically the right hemisphere of the brain. I had this dad tell me a few weeks ago, he said, Amanda, because we at Brain Balance, we have these smell kits and we hand them out like water. And there's certain smells, like, for example, peppermint, eucalyptus. Let's see, what are some other ones? Cedarwood, stress relief if you use, Young Living products. But they're basically anything that's earthy smelling, like lavender, eucalyptus, peppermint. All of those can help activate specifically the area of the brain related to controlling impulsivity, helping activate that right brain to help calm a child down. And so I had this dad tell me a few weeks ago, he said, Amanda, he said, and their daughter was struggling with a lot of sensory difficulties, and she would have big meltdowns. And she's only 4, so she's young. And, it was a new perspective to look at behavior from a neurological perspective. And so he said, I know you told me to utilize the smells when she's really struggling and we're in a meltdown. And he said, but I'm going to be honest, I thought that was a little weird. He's like, I'm just going to be honest. As a dad, I thought having her smell vials of essential oils was weird. He said, but then sure enough, the next day after he told us this, we find ourselves in a meltdown. He said, talking to her doesn't work. He's like, we've tried the traditional methods of how to calm a child down, in a meltdown. We've tried the disciplining. That doesn't work either. He's like, so I figured, well, we're at Brain Balance. We might as well try this new perspective. Sure enough, he gives her the smells and he's having her smell. He was like, I could not believe it. He said, it was just within not even a minute or two that she started calming down. And he said, and then she allowed me to hold her and allowed me to comfort her, which was also something she doesn't like tactile and she doesn't like to be touched. And he was like, and here I have my daughter in my lap for the first time in a very long time since she was a baby. And he said, and I just couldn't believe it. And so that's the thing, is that senses develop the brain and motor develops the brain. And so we want you to be able to have some resources immediately to be able to activate your child's brain. But then also too, if you're just like Liam's mom, that's like, we've tried a lot of things, we've done a lot of different therapies, and we still feel stuck as a family. Well, I would love to offer you guys a comprehensive assessment where we can give you the answers of, does your child have primitive reflexes that's inhibiting brain development? How is their sensory perception? How is their sensory processing related to vision, auditory, smell, touch? Because that's really good information to have to be able to look at strengths in brain function and perhaps where there are weaknesses in brain function that can impact that cross communication in the brain. And so in our comprehensive assessment, we look at all of these different areas. We look at the right hemisphere of the brain. We look at the left hemisphere of the brain. We look at core strength, muscle tone, body awareness. How well is your child's body coordinated? We also are able to look at eye tracking, specifically to reading. And then, of course, we look at behavioral components as well. So we do offer a comprehensive assessment to really give you the answers of where's your child's strengths in brain function and where are their weaknesses that could be impacting the cross communication of the brain. And then from there, we are able to put together a customized plan to where we can strengthen any underconnectivity in the brain, because a connected brain is a teachable brain. And so this is something that if you watch the webinar, you actually get a discount on our assessment. Typically, our assessment is $295, but when you participate in a webinar, we can offer it for $145. And so this is something that I encourage each of you to do, is to be able to get answers of why your child is struggling. Again, looking at where are their strengths and where's their potential as far as connectivity in the brain, because we often serve children that are gifted in certain areas where they're functioning above their chronological age in certain areas. And so again, sometimes we're not going towards age appropriate, we're actually going above their chronological age to get connection, to get balance, because a coordinated body, a coordinated brain, a connected brain is a teachable brain. That's where they will learn academically and socially and emotionally. And also a connected brain, specifically in the right hemisphere, helps modulate sensory input. So just like Liam's mom shared with us, that over time, you can see his ability or her ability to be able to process senses more appropriately, because that brain is able to cross communicate effectively and efficiently. So I want to thank you guys so much for participating today. I loved hearing your input from the poll questions. And these are definitely, I want you to walk away with two things. One, understanding that there's a neurological response that is taking place when a child is struggling with sensory input, that it's related to how their brain is developing. But the good news is that their brain is still developing. And here's the excellent news, is that we thought, well, once Someone hits 25 years old, that's it. Their brain can't develop any longer. But that is not true. Through the study of what we call neuroplasticity, we can change the brain and improve the function of the brain all the way through adulthood. So many of the centers do offer an adult program. It launched about a year and a half ago. We're super excited about it. And so even adults can get answers of why they are struggling with sensory processing. So again, thank you guys so much for participating. I hope that this was super helpful for you. All right. Well, you guys have hung with us for quite some time. And again, it's always a privilege to be able to share with you just hopefully information that can be helpful. And so again, thank you we do a webinar every month on different topics. Next month, we're going to be talking more about what we call executive functioning skills, which is really about independence, goal setting, motivation, but really about follow through, the ability to follow through on goals that are being set. So I would love for you guys to come back next month, because I will say that if you are having any challenges with a child, related to sensory processing, related to dyslexia, any types of symptoms that are a struggle, attention, focus, that will absolutely impact what we call executive functioning skills. And so it is a great topic and something to come and join us again next month. So again, thank you so much for participating. We hope this was very helpful. Please answer the final poll questions. They're open-ended, so you can actually really give some really good feedback for us. And again, like I shared with you, we utilize that feedback to make things better for you. So again, thank you so much for participating.